Well, good morning, everyone. Thanks for joining us today. I'm Matt Greco, the events manager here at PSS Life University. And today we're very lucky and happy to have Dr. Joyce Fogel. And with that, I'll hand it over to Dr. Fogel.
Great. All right. Good morning, and I'm going to share my screen. There we go. I love it when it works. And I'm happy to be here talking to you this morning about optimal aging, or what I call how to be chronologically gifted. And we'll talk a little bit more as we go along about what that means. There's been this anti-aging hype where people say, how do I stop aging? And these are just, things that I found on the internet about anti-aging secrets, the anti-aging discovery. But in fact, we should celebrate aging. We don't want to stop aging. There is this stigma that in our society that aging is a burden. And this is both imposed by society as well as self-imposed. In one survey, 40% of people were afraid of aging. Aging is predictable. It is inevitable, but we need to talk about how we can potentially modify how we age so you age optimally. And we'll talk about what that means. Some people approach aging as the wise old owl and say, well, this is where I am and this is what I have to do. Some people stick their head in the sand and say, I'm not getting older. I don't need to do anything differently. Or they slow down. Or, they can be the turtle and the hare running after each other. So, you can think about which one are you. So I mentioned our population is aging, okay? If you're 65 now, you have a life expectancy of about 19 years. But if you're 85, it's expected that you have about 7 years of a life expectancy. So that's pretty interesting, considering that when Social Security was begun, it was based on the 1935 average life expectancy for a man being 60 and a woman being 62. So we've come a long way. In 2011, the baby boomers started turning 65. So that's 78 million people who started turning 65. And so we are increasing our population. Now, 1 out of every 4 people who are 65 live to the age of 90. So we have a growing older population. So here are some things for you to think about. As I said, our population is growing. What percentage of people over 85 do you think report good or excellent health? So you can just think about a number. I'm not going to take the time to gather it. That number is 70%. Some people think, oh, everybody over 85 is just doing poorly. Nope. Percentage of people over 85 who have significant limitations in their function or cognition? 40%. Again, maybe not as much as you would have thought. Percentage of people over 85 who live in nursing homes? 13%. Not as many as a lot of people predict. So people are living longer and they do have functional and cognitive disabilities, but many are living in the community in good health. And how do we maintain that? Think about John Glenn. Too many people, when they get old, think that they have to live by the calendar. And that's not what we want. So I said we'd talk about optimal aging. So what is optimal aging? Is it the same if we talk about healthy aging? Is successful aging or optimal aging? Is it all the same, or effective aging, positive aging? All these terms have been used. So there's a difference. Some people consider successful aging is that you are aging without disease and disability, with very high functional status. But the reality is that as we get older, there are challenges, whether they are cognitive or functional or social. And optimal aging is recognizing this reality and working with this reality to improve satisfaction and function, incorporating whatever challenges an older adult might have. So, what plays a role into aging or optimal aging? So, there are definitely a lot of things, hereditary things. So, you know, people will say, my mother lived to 102. I hope I get to live that long. So, that definitely plays a role. What underlying diseases do you have? High blood pressure, diabetes. Physiology, that means the changes that occur with aging that are expected as normal aging. So that may be a decline in kidney function, hearing impairment, some visual changes. And then there is where and how we live, the environment and the lifestyle that we live are all playing a role. So some of these things we can't really modify. We can't modify what we've inherited. We can modify what diseases that we are living with. We can't necessarily modify the physiology, but we can modify how we live. I like to tell the story when I think about this, about Winston Churchill. Winston Churchill was being photographed on his 80th birthday, and the photographer said to him, "Oh, Mr. Churchill, I hope I have the honor of photographing you again on your 85th." And he turned around and said to the young man, "I don't see why not, young man. You look perfectly fit to me." So he had an incredible attitude towards aging. So when we talk about how we can modify things, we're going to talk about prevention. We're going to spend a lot of time this morning talking about primary prevention. Primary prevention is preventing a disease or illness before it occurs. So we're going to talk about exercise, nutrition, smoking cessation, alcohol use, very importantly, especially at this season, immunizations and home safety. All of this fall under primary prevention. And then we're going to talk a little bit about secondary prevention, which is how do we pick up a disease you may already have early to treat it and prevent long-term complications. So, first thing in primary prevention is getting active. People who exercise have better health than those who don't. So, you need to increase it. And increasing your activities doesn't mean that you have to start running on a treadmill. Older adults need 30 minutes of moderate exercise 5 times a week. So if you can't do 30 minutes all at once, that's okay. You can do 10-minute intervals of exercise. It's getting to the winter, you can't get out. You live in an apartment, walk the halls. Do laps around your apartment, walk stairs. So focus on opportunities that you can have within your community. And we're going to talk about falls and injury prevention. So exercise doesn't have to be traditional exercise, right? So as I said, you don't have to get on a treadmill. In fact, grocery shopping is great exercise, right? So that walking increases endurance. Okay. Increasing strength might be lifting weights. You don't have to go to the gym to lift weights, right? You want to increase your upper body strength? Take 2 1-pound cans of beans and use those as your weights and do some arm curls with them. So you can increase that strength. One of the best things you can do for your balance is Tai Chi. And many older adult centers, Wise, have Tai Chi programs. Stretching will increase your flexibility. So Exercise doesn't just, increase your ability to do more. It improves heart health, lung health, bone health, and muscle strength. So there's a lot of benefit to exercise in disease prevention. But we also, when we talk about primary prevention and we talk about exercise, we also want to prevent falls. So falls are a leading cause of fractures. People who fall are then afraid of falling and don't want to do exercise. They don't want to go out. So exercise programs should be done carefully. Maybe you need to walk with a partner. Maybe you need to join those exercise groups in a group setting so there's supervision. Most falls actually occur in the home, and they occur going to the bathroom at night. So, leaving lights on, looking at your environment, getting rid of scatter rugs, making sure lights are left on, making sure you're using your assistive devices, cane walkers appropriately. Don't say, oh, I'm just walking to the bathroom, I don't need to take my cane, because that's a setup for falling. Socialization, is that prevention of issues related to aging? It certainly is, okay? Because we know that social isolation really can lead to cognitive decline, depression, sleep issues. People who are socially isolated might not get out as much, might do less. So there really is a harm to social isolation. So in that, prevention is encouraging people to get out, maintain communication, socialize, never stop learning and challenging your mind. We know one of the best things that you can do for your memory is to continue to challenge it. Sleep. So, poor sleep is definitely associated with depression and cognitive changes. So, get enough sleep. Lack of sleep can increase your risk of many things. I have many patients who tell me they have sleep issues. And then when I start asking questions, there's no regular sleep schedule. They are watching TV in bed. They're drinking caffeine late into the day. When they get up at night, let's say to go to the bathroom, rather than trying to go back to bed, they start watching television. So you can make changes in your lifestyle that can improve sleep. If you have sleep problems after you've made some lifestyle modifications, do talk to your healthcare providers. Sometimes sleep problems are caused by medical conditions that need to looked into, like sleep apnea, or it's related to some of your medications. The great weight debate. So, weight is something else that we actually can modify when we look at optimally aging. There's been this debate about, am I better off if I look like an apple or a pear? And what's the best weight for me to have as I get older? And the guidelines are actually different as you get older. So if you look at this is a BMI calculator. So what a BMI calculator does is it takes your height and it takes your weight and it calculates your body mass index, which is a better way to look at your weight. So this normals are put together for younger adults. But in fact, what's considered an ideal BMI for older adults is between 24 and 27. So while it might be that little bit of extra weight might be considered overweight for a younger person, it may not be in an older adult. So this is a good way to see where you stand. How many calories do you need? It's another question that I'm asking. So these are just some guidelines of how many calories you need depending on how active you are as a man and as a woman. So just as a guideline for how much someone might be eating, if you're eating a Big Mac, a large fries, and a chocolate shake at McDonald's, you've hit more than 1,500 calories. So, as a not physically active woman, you're done for the day. While if you ate a slice of pizza, that's about 300 calories, maybe a better choice. So, looking at what you're eating and getting a rough idea of those calorie counts can be very helpful. These are some general guidelines of how much you should be eating. And if you're looking, if you pay attention, fruits and vegetables are up at the top, and that's where we should be focused. Grains are less. Okay, so things like pasta and rice should not be the the main dish. They should be the side dish. And one way to think about this is if you take a plate and you divide it in four. Half that plate should be your vegetables and your salad, and 1/4 can be the grains, the pasta, the rice, the potatoes, the carbohydrates, and the other quarter of the plate is your protein. So it's a way to visualize it when you're setting up your meals. Some of you may have heard of the DASH diet. DASH diet is a diet to improve cardiovascular health and to reduce sodium intake for heart health. The MIND diet is a combination between the DASH diet, or a low sodium heart healthy diet. So the good fats like olive oil, canola oil, avocado oil, staying away from things like palm oil and butter, and a Mediterranean diet, which has much more vegetables and fish and green leafy vegetables. And this has found, there was some studies showing that this could be beneficial in brain health. I'm not sure how good the evidence is, but I think there's no harm to it. So thinking about what you can do both in reducing fats, salt in your diet, less red meat, more fish, more green leafy vegetables can definitely be beneficial. So I talked about the good oils. Why do you need to control cholesterol? What's so important about it, right? What's so important about controlling cholesterol? Because if your cholesterol is higher, you're at major risk for heart disease and stroke. So you should have it measured on a regular basis. Look at what you're eating. Exercise will improve your body's ability to make good cholesterol. So it's important to know that your liver and your body cells make about 75% of your cholesterol. The other comes from your food. So there we go to the hereditary factors again. So some people say, well, my mother had a really high cholesterol as well. And no matter what I do, I can't change this with diet. So medication definitely is an option, especially if you are at risk for heart disease or stroke, and it's something that you can talk to your healthcare provider about. But that doesn't mean that you shouldn't be looking at what you're eating in terms of the fats in your diet. Reducing blood sugar. Again, high blood sugar encourages plaque in your arteries, increases the risk of diabetes, heart disease, and stroke. You may have had a hemoglobin A1C measured, which looks at blood sugar over time. It's important to know that what that acceptable number is a little bit higher as you age. So the number that's considered normal for a 25-year-old might not be what's acceptable for someone who's 85. So you will reduce your blood sugar by making healthy choices in your diet. Is eating nuts, low salt nuts a better choice than eating the cookies, maintaining a healthy weight and exercising. What about wine? I love Betty White. She says that a glass of wine a day can extend your life. Well, look at the size of the glass she is drinking. So, in fact, a standard drink is 12 ounces of beer or 4 to 5 ounces of wine, depending on the alcohol content, or 1.5 ounces of hard liquor. No more than one drink a day. And in fact, there's more and more evidence coming out as people age that they should be drinking even less. But for sure, no more than one drink a day. And speak to your healthcare provider because alcohol may interact with some of the medications that you are taking. As you get older, you have less total body water, meaning there's less water in your blood, and alcohol is water soluble. So you get a higher blood level of alcohol as an older adult than you would as a younger adult for that one standard drink. Don't smoke. It is the number one modifiable risk factor for causes of death. So if you are smoking, there are lots of things that can be done, from support programs to medication to nicotine replacement, and look at what difference it can make. In the year after you quit smoking, your risk of coronary disease or heart disease drops by 50%. 50%. What about supplements? Is this going to help me? Is this good prevention? I get asked this all the time, right? Shouldn't I be taking lots of these supplements as prevention for me aging? So the first thing is, in general, we recommend supplements when someone is deficient. You're iron deficient, you're vitamin D deficient or B12 deficient, and calcium, maybe if you have osteoporosis. And these things can be discussed with your physician and have them measure blood levels. You have to be very careful because taking mega doses of things like vitamin D can actually be detrimental. So you want to be careful what you're taking and don't keep it as a secret. Share it with your healthcare provider. Um, Vitamin A, D, E, and K are what's called fat soluble vitamins. So they're stored in the body. So people tend to have storage of them unless they don't absorb them. So they may have malabsorption or gut issues. There's been a lot of hype about other supplements like, will cinnamon prevent my diabetes? There's been a little bit of evidence out there. I don't think it's going to hurt you, especially using it in cooking. Turmeric and curcurium in joint health. Omega-3 or fish oil the pendulum has swung both ways. I say get these things in your diet. It's probably eat that fishy fish. It's good for you, as we talked about the mind diet. Red rice yeast, which is essentially a statin, a naturally occurring statin. Some people prefer it to taking a statin for their high cholesterol, but supplements are not regulated. So you may buy one brand and it may be different from another brand in what you take. So you have to be careful. And if you are taking supplements, get them from a reliable source. Pills to prevent aging. I've had people say, I'd like to take some estrogen to prevent aging. There is no evidence that taking hormones will benefit preventing aging. If someone is deficient for a particular reason, then it may be suggested. Antioxidants. So antioxidants are actually used a lot for macular degeneration, those eye vitamins that your ophthalmologist might prescribe. And there's some thought that antioxidants may help in protecting your cells from aging. The best way to get it, again, is in your diet. Things like blueberries have a lot of antioxidants. Resveratrol, it mimics calorie restriction in mice who may have lived longer. There is no human evidence for this. So just putting that out there for you. What about for brain health? Will I prevent brain deterioration by taking these? So if you're having memory problems or you're concerned about it, there are certain vitamin levels like B12, that B12 deficiency may contribute to memory problems. But there isn't good evidence that any of these things will, taking them if you're not deficient, like in B12, will prevent memory problems. There's a lot out there, but there is no evidence that these things will prevent memory problems. And we'll talk about what you can do for brain health. Oops, I wanted to show you that slide and it went away. Okay. And I love Maxine cartoons, and she said, "Don't cry over spilled supplements." So it may not be the way to go. All right, immunizations. I'm going to shift gear a little because immunizations is primary prevention, preventing a disease before it occurs. We are at the season where we're starting to see flu. It's important that you get your seasonal flu vaccine. You had it last year, not good enough. All seasonal vaccines right now are trivalent. They're covering 3 strains of influenza A and influenza B. You can get a higher dose vaccine as an older adult, and so it may help build up your immunity better because as you get older, you have a decreased immune response. So getting that flu vaccine is really important. The other updated vaccine that we are recommending is COVID. COVID is also being adjusted now as a seasonal vaccine. There is a new vaccine for 25-26 that's available to you. Check with your pharmacist or your healthcare provider if you've recently had COVID, whether you are eligible to get it and when your last vaccine was. There were older pneumonia vaccines. You may have heard of pneumonia 13 or 23. These were older vaccines. The newest vaccine is pneumonia 21. So it's been 5 years since you've had those older vaccines. You should talk to your healthcare provider or pharmacist about getting 21. If you've never had pneumonia vaccines, go ahead and get 21. Tetanus every 10 years. So if you fall, you get injured, you are covered. We give tetanus now as Tdap because it includes pertussis. There is an increase in pertussis or whooping cough in children, and by immunizing the general population, we are causing herd immunity and protecting our children as well. RSV or respiratory syncytial virus. This vaccine has only been available for a few years. We used to focus on this mostly in children, but we found that it was a significant cause of respiratory illness and hospitalization in older adults. Very grateful that a vaccine has been developed, and it's recommended for everybody over the age of 75. Below 75, if you have high risk factors like lung disease or heart disease or kidney disease, talk to your healthcare provider. Hepatitis vaccine is not universally recommended for older adults. We recommend it for people who are high risk for hepatitis B to get vaccines. So healthcare workers, people who use intravenous drugs, men who have sex with men, people with multiple sexual partners, then we may recommend it. Or traveling to countries that have a high risk of hepatitis A and B, then it may be recommended. There are other travel vaccines. So if you are traveling, you can check the CDC website for travel guidance, and it will tell you what immunizations you do need. You can talk to your primary care provider or a travel clinic about getting those vaccines. So secondary prevention, I mentioned that secondary prevention is picking up a disease before it causes complications. So making sure we're checking people for their hypertension or screening for diabetes and treating it before there are long-term complications. So we talked about some of these in the primary prevention, looking at hypertension and diabetes. So that can be both primary prevention, preventing hypertension and diabetes, and secondary prevention, screening and treating early to prevent complications. So we talked a little bit about blood pressure, so I'm going to move past this a little bit. And because I want to spend some time on cancer screening. This is another place where people are often confused. Oh, I'm 75, I'm done. So let's talk about these one by one a little bit. Breast cancer screening, okay? Breast cancer increases with age. After age 75, screening should be done based on patient preference, life expectancy, quality of life, and risk factors. So if someone is a really robust 75-year-old and they have a life expectancy of more than 10 years, I recommend continued screening, because if we pick up a cancer in a 78-year-old, we can improve their life expectancy. Right? Your sister had a history of breast cancer. May be worthwhile continuing screening. On the other hand, an 80-year-old with advanced Alzheimer's who's bedbound, who has a limited life expectancy, doesn't make sense. Colon cancer screening, never recommended after the age of 85. Colon cancer screening can be doing stool studies, either checking for blood or something called Cologuard, where you're given a box to mail away a stool sample and it checks both DNA and blood in your stool, or doing colonoscopy. Those stool tests are only acceptable for people who have average risk, no prior history of polyps, no family history of colon cancer, no prior abnormal colonoscopy or bleeding. Then Cologuard might be acceptable. Colonoscopy for people who have had normal colonoscopy before is every 10 years. If you've had polyps or a family history, it may be recommended that you do it more often. Prostate cancer screening is very controversial. So there are a lot of false positives with PSAs, and then people have to go on to biopsies and other tests. So after age 75, if someone is of average risk, it's generally not recommended, but shared decision making can be done to say, well, do I want this test? And if I get it, would I be willing to go on to have other testing? And between 50 and 75, it's a discussion with your healthcare provider. Cervical cancer screening or pap smears. If someone is over the age of 65 and has never had an abnormal pap smear, then they can either stop or decrease screening to every 3 years, depending on their risk, family history. But in general, routine screening is done up to the age of 65. Lung cancer screening, if you have smoked 30 pack years, which means, let's say, you smoked a pack a year for 30 years, that's 30 pack years. Below the age of 80, then it is recommended that you have a CAT scan, which is a low dose CAT scan, to evaluate you for any abnormality that may need further workup. Skin cancer screening. So skin cancer goes up with age, and often it is overlooked in older adults. If you were one of those sun worshippers or have a lot of pigmented skin lesions, so you should definitely have an overall skin check by a dermatologist. Any skin lesion that you see changing deserves attention. What about screening for memory impairment and picking that up early? So I want to emphasize that memory impairment is not a normal part of aging, okay? So if there are concerns about memory impairment, we want to address them. So in typical aging, someone might forget some words, but it comes to them later, but they don't substitute it with a word that doesn't make sense. They don't get lost in familiar territory. They maintain, so normal aging people maintain interpersonal skills. When you're worried about cognitive impairment, often a family is coming to us and saying, Mom or Dad has had some real decline. They're no longer paying their bills. They got lost coming home from the dentist. They can't maintain a conversation. So those things are not typical aging. The occasional word loss, I tell people, if you misplace your keys when you come into the house and you can retrace your steps and find them, that's normal aging. If you can't find your keys and you put them in the freezer, then I'm concerned. I want to emphasize we've talked a lot about heart health, that heart health is brain health. So, you know, doing those things to promote optimal cardiovascular health is also good for your brain. So the exercise, the improved diet, cognitive impairment can occur from small strokes as well as things like Alzheimer's disease. So maintaining social engagement, doing puzzles, getting good sleep, those all are really good for brain health. Um, so just here's some more input about those cardiovascular factors that are really important in brain health. I want to remind you to don't put a hold on your health care as you get older, to pay attention to both primary prevention as well as secondary prevention. So doing those things that you can do within your environment, your exercise, your lifestyle, as well as talking to your healthcare provider about screening and prevention. Knowing what's meaningful to you. And I think that's important as well as you move forward and optimally age, knowing where you want to focus. So I feel like I have to include in here, although it's not about how to optimally age, it's about knowing what's important to you as you get older, is making sure your wishes are known. So completing a healthcare proxy, which means appointing someone to make decisions for you about your healthcare if you can no longer make those decisions for yourself. And that's the big if. You have autonomy. You get to make your decisions. But maybe something happens, right? Whether it's cognitive impairment or a stroke, or we hope it doesn't happen, you get hit by a car, and someone has to make a decision for you. Right? In some states, like New Jersey, it's called the durable power of attorney for healthcare. Living wills let you put your wishes in writing, but these are not legal documents in New York State. A healthcare proxy is. Is a surrogacy law in New York State, which means that if you don't have a healthcare proxy, there is a hierarchy of who gets to make decisions for you, but it may not be the person who you wanted to make decisions for you. Emolts and emolts, we really don't have time to talk about, but these are documents as people have more advanced disease where they can speak to their healthcare provider. These are medical orders for life-sustaining treatment about what their wishes would be regarding resuscitation, feeding tubes, dialysis, and those writings can be, and those wishes can be put in as orders by your healthcare provider. That's just a picture of a New York State healthcare proxy form. You can fill it out yourself. You can download it from the internet. It does not require a lawyer. It does not require a notary. It only requires two witnesses for you to be saying, I know that I am appointing John Doe to be my proxy. It's hard to talk about this. It's hard to think about, well, who do I want to make decisions for me and do I know what they are? Do it anyway. I'm going to end by saying aging is not a decline. It's a different stage of growth. So keep your mind engaged, move your body, think about prevention and screening, prioritize sleep, stress reduction, healthy eating, stay socially connected, and live your life with purpose and resilience. And that's what's going to help you optimally age. I'm a geriatrician by training, and geriatricians look at older adults a little bit differently. So I put this here for you. So this actually is a rubric we use called the 5Ms, which we focus on looking at mind, mobility, medication, what matters most, and multi-complexity. And these are all things that we really talked about as we talked about optimally aging. To quote George Burns, you can't help getting older, but you don't have to get old. These are some references for you. I am happy to share this presentation in a PDF form, and I can send it to Matthew if anybody wants access to it. And with that, I'm going to stop screen sharing. I promised that I would leave time for questions, and I believe we have time. So I'm going to stop sharing.
I do have a couple of questions that occurred to me. You never mentioned pets. I'm just wondering what you think about pets in terms of
Oh, I think
healthcare.
pets are great, actually, because it can actually improve social isolation. And, sometimes we have to be careful about what pets people get. If they have mobility issues, can they walk a dog? Is it realistic? Can they take care of them? So looking at what kind of pets they're getting and how they can take care of them, or do they need someone to help them take care of the pet? I have had patients who met other people in their neighborhood who they never met before walking a new dog and became socially connected.
Yeah.
One question that's here is, how should I seek a geriatric primary care physician and how do I find them? Well, so there aren't enough geriatricians to take care of all the older adults as they age. There are only about 8,000 of us who are board certified right now. We are working to train our younger physicians who are doing general internal medicine to understand geriatric concepts. I recommend that people who have multiple medical problems with complex needs seek a geriatrician. So certainly people with cognitive issues, falls, what we call failure to thrive, like lots of functional impairment, maybe falling a lot, polypharmacy, so taking a lot of medications and are concerned about side effects. So we see patients in our practice both as primary care as well as consultative practice. So you may have a primary care physician who you really like, but you think that maybe there is you have some geriatric issues and you would like them looked into more carefully. You can also do that and be seen as a consult. How do you find one? So I can tell you that all the major academic centers in New York City have geriatric practices. We at Mount Sinai have three. One is downtown Union Square, where I practice. One is at Mount Sinai Morningside, which is on the Upper West Side, and at the main hospital campus on the Upper East Side. But Columbia, Cornell, NYU all have, Northwell, all have geriatric practices. So if you get your medical care somewhere and you want to see a geriatrician, you may reach out. So that's a way to get a geriatric physician. Um, how do we help a parent that has been diagnosed with early onset Alzheimer's? Are there medications to slow the process? So, if someone has early dementia, there are a number of things that can be done. Socialization is really important. So, we focus on the skills that they do have, right? What are they able to do? Being with family, being in support groups. Um, both the Alzheimer's Association and in New York, an organization called Caring Kind has incredible resources. So Caring Kind does have a support group for people with early disease, and that's really a great option. It also has support groups for families, as does the Alzheimer Foundation of America. So these are all great resources. Are there medications to slow the process? So there are medications that can be used to potentially slow decline. One of them you may have heard about, known as donepezil or Aricept, and your healthcare provider can look and see if it's appropriate to start it. There are newer medication called monoclonal antibodies that are the first drugs out there. There are infusions to target the plaques, the amyloid plaques in the brain, to decrease those plaques that may reverse the disease. These medications are fraught with a lot of side effects and need very close monitoring and have to be used in a cognitive center. So, with people with early disease, there is that is also an option if they're willing to go that route. My dad will be 101 in January. That's amazing. He does not want to eat. He's down to 103 pounds. Would Remeron 7.5 help? He's currently in a short-term rehab. So, why do people not eat as they get older? Sometimes people have loss of appetite from medication. It may be a side effect of their medication. They may have swallowing issues. So it's worth looking to see, are they having difficulty swallowing? Are there consistencies? People with advanced dementia or brain issues may just not get the message to swallow, to eat. So they may not eat. They may forget to eat. Looking at food preferences. People in rehab may not like the food they're being given. So it may not be what they're being fed at home, especially, you know, culturally. If someone is used to eating rice and beans with their meals and that's not available to them in rehab, they may not eat and they may lose weight. So looking at what they're being fed and um, how you can improve it, looking at food preferences, speaking it to a nutritionist. So Remeron, or the other name for it is mirtazapine, was originally developed as an antidepressant drug. It's been found that people who took it gained weight and also it improved sleep. So sometimes we will use it in a combination if someone is having, you know, poor appetite and poor sleep and maybe some depression. Depression will also decrease appetite. Right? Looking at his other medications to say, are any of them affecting appetite? And bring food from home. See what options are available at home for him. Do you have a perspective on when it's too late to move someone from the home they're familiar with? My mom turned 90 in February and is resistant to leaving her house. We don't want to accelerate her demise. So I think if I understand this question is if someone has been living long term somewhere and families feeling maybe that they would be better served by changing their residence, moving closer to family, moving to an assisted living facility. Um, in general, people tend to do better unless there's a reason to move them in a familiar place. So someone who wants to stay in their home may be looking at how you can maintain them in their home safely. Do they need additional home care, more physical therapy, modifications made? There are steps, they can't do the steps. Can you put a chairlift in? Um, what's the safety concerns? That being said, there are times that people do have to leave a long-term residence because it's not safe for them. And they may get more confused, especially if they have memory impairment and you are moving them. Um, and so sometimes it's difficult. You can trial people. So if someone's thinking about moving to an assisted living, there are financial constraints because a lot of these assisted living facilities are quite pricey. But someone can have a trial. You can talk to them and not give up mom's apartment or her residence and move somebody, say, let's give it a try for a month. And they may find that they love the activities and this is right for them, right? And that they're getting meals cooked and they're eating in a dining room. So giving them a trial. If somebody is being moved to um, another state, it can be very difficult because they are leaving what they know. And that may be the choice because it's bringing them closer to family. So you need to know that there's going to be a lot of adjustments and people may be leaving their social supports. Um, so there was another note about the same question about sometimes forgets to eat. So why do people forget to eat? So memory impairment, certainly people with memory impairment may forget to eat. But we also see that older adults sometimes don't want to eat alone. They may be cognitively intact, but they just don't want to prepare food or eat alone. Eating in group settings can make a big difference, whether going to an older adult center where meals are provided, um, or talking about meeting friends or eating with family a few times a week may be the big difference. So for appropriate people where it's indicated, there are delivered meals that are available through various agencies like Meals on Wheels, God's Love We Deliver. They have to have appropriate indications, but for people who cannot prepare meals, um, and don't have the same access to food, these are also good options. And social workers within community centers or in your doctor's office may be able to help you with that. And
Dr. Fogel, I have a question. Talking about eating less, what about sleeping less? Um, do people sometimes not need as much sleep as they age?
so teenagers need more sleep. So as you age, yes, that's a really good question, Matthew, that people do probably need less sleep. And, probably rather than 7 to 9 hours, 6 to 8 hours might be a more reasonable thought. But remembering if people nap during the day, it's cumulative. If you napped for 2 hours during the day, don't expect to sleep 8 hours at night. And if they're not physically active, they may not be as tired and need sleep. So we talked about physical activity. So being physically active will definitely help sleep. And if you can't get out, find an online Zoom exercise program. As I mentioned, walk your hallways. So being physically active is really important for sleep and looking at those other lifestyle modifications for sleep. When I ask people about sleep, I'm often really surprised to find out how many of them are still drinking caffeine late in the day and then worried about their sleep.
What about napping? Is that something you recommend or not recommend?
So if someone's having trouble sleeping at night, I don't recommend napping. I try to get people to avoid. Sometimes people with significant medical problems may feel they need to nap during the day, but they will sleep less at night. So I would say try to avoid napping. If someone does nap or they feel that they come back from an activity and they need to nap, set an alarm so you don't sleep for 2 hours. Maybe that half-hour cat nap is enough to refresh you.
Yeah, what about a 10 or 15-minute cat nap?
So there's actually been some good evidence that even younger people might benefit from that 10-minute cat nap at work during the day. I wish I could get one.
I need a siesta hour.
Right. We all need some downtime. So whether that's, setting the alarm for downtime or if there's been a physical activity, just taking a break and resting. We don't expect people to keep going on and on and on. Um, but getting that physical activity and modifying what you do. It has been my pleasure to speak to this group. Thank you.
Thank you. Bye-bye.